Hi, I'm Abdal Alvi, the Chief Clinical Officer here at Simple Online Pharmacy. I understand that patients are worried about the impact of the recent Mounjaro price changes and what it could mean for them in their weight loss journey. So I want to take a few minutes to talk about this, what it means for you and the options that you now have. This change hasn't come from us. The manufacturer of Mounjaro, Eli Lilly, has increased their prices from the 1st of September across the UK, and unfortunately this is affecting all private providers. We know this can be worrying, and we want to be clear and upfront with you about what it means. You essentially have got two choices. You can continue on Mounjaro or you can switch to Wegovy. Both are highly effective treatments, and whichever one you choose, our clinical team is here to support you. If you decide to stay in Mounjaro, you can carry on as you are, titrating up or staying on a maintenance dose. You can even reduce your dose to still gain benefit while helping to manage costs. Based on average weight loss data, some lower doses of Mounjaro have actually been shown to be just as effective as the higher Wegovy doses. However, patients do respond to medicines very individually, so you need to explore what will be right for you. Wegovy is a medicine that many patients aren't actually too familiar with. It contains the same medicine as Ozempic, semaglutide. However, Ozempic is only licensed for diabetes in the UK, unlike Wegovy, which is licensed for weight management. It's also used once weekly. It's more compatible with oral contraceptives and has actually got added benefits around heart health. Currently, there are 5 steps to maximum dose, but a new dose is being released next year to make this 6 steps, just like Mounjaro. If you decide to switch to Wegovy, it's straightforward and we can suggest a safe dose for you to switch to, so you won't need to restart your treatment from the beginning. Just don't use Wegovy and Mounjaro together, and make sure that you leave at least 1 week from your last dose of Mounjaro to your first dose of Wegovy. During your assessment, simply answer the questions as usual. You'll be asked what you're currently taking, so Mounjaro, and at what dose, and then whether or not you'd like to switch to Wegovy. From there, you'll be guided to the most appropriate dose for you. If you're worried about side effects, you can also choose a lower dose as well. You'll be given all the important information about switching within the assessment. Please read this carefully. Some people worry when they see that Wegovy dose numbers look smaller than those of Mounjaro. Mounjaro starts at 2.5 milligrams and continues all the way up to 15 milligrams. And when patients see that Wegovy doses start at 0.25 up to 2.4, they think that it's weaker because the numbers don't compare. It is important to understand, however, that these medications can't be compared directly like that. Wegovy is a powerful treatment in its own right, and clinical trials show that it helps patients to lose an average of around 17% of their body weight over time. Mounjaro is slightly higher at 22.5%, but both are excellent options, and one might work better than the other for some. It really depends on the individual. Side effects are often similar to those experienced on Mounjaro, with things like nausea and stomach upset, but if you tolerated Mounjaro well, you'll likely manage Wegovy well too. And remember, our clinical team is here to support you if you need any dose adjustments or have any concerns at all. During your assessment, we'll advise you on which dose is most suitable, but if you feel worried about side effects, you can even start at a lower dose and gradually work your way up. You can find more information on our support page linked in the bio. Yeah, you can switch mid-cycle if needed, and our updated assessment process will support that, but you can't use both Mounjaro and Wegovy together, and you will need to take a 1-week break between the medications. You might also choose to lower your Mounjaro dose and to reduce your costs while staying in treatment. Lower doses of Mounjaro are still very effective. The good news is that we've got stock of both Mounjaro and Wegovy, and although we were prioritising our existing patients, we have now reopened to new patients as well, including those joining us from other providers. Above all, we know this kind of change can feel unsettling. Our priority is to keep your journey safe, supported and affordable, and to make sure that you have clear choices. If you'd like more details, go to our link in the bio to find our dedicated support page and all the information you'll need about switching. Please do take a look, and as always, if you're worried or have any questions at all, reach out to us. We are here to help.